Right, okay, so hello, this is Healthwatch Berry, and today we're doing our live with Macmillan Cancer Support. We have lovely Sarah here, so I want to thank her in advance for spending her time with us. Just going to go through a couple of things before we get started. We have some Livestream guidelines, so basically we want everyone to be accepting, welcoming, regardless of race, ethnicity, national origin, religious affiliation, sexual orientation, sex, gender identity, or ability. We need to respect boundaries. Don't make advances or comments on appearance that might make someone uncomfortable. Don't be rude. Don't be intentionally provocative or threatening or insulting to anybody. Not like we've had that in before, but it's nice to put it in. We don't want to flood the chat. We want the conversation to keep going, but if we keep sending the same comments, sometimes different comments can get lost along it. So we ask that doesn't happen. And we're not here for a sales pitch, basically. So if you've got something going on that's related to Macmillan Cancer, brilliant, mention it. But if not, can we save it for one of our other lives when it'd be a bit more relevant for us, please? And we obviously would like to keep it clean. So no shocking, obscene, vulgar or inflammatory language. We'll leave that out. We're going to have Healthwatch Berry introduction at the moment, which is what we're currently going through, followed by Sarah with Macmillan Cancer Support, who will tell us a lot of information about what they're doing, and then Steph's going to host our Q&A for us. So what is Healthwatch? Healthwatch is your health and social care champion. We make sure the NHS leaders and other decision makers hear your voice and use your feedback to improve care. We listen to your experiences of using health and social care services and share them with those with the power to make change happen. And we can also provide information and advice if anyone is struggling to access services around their health and social care. We can support you by signposting you to local or online support groups. We can give you information and advice about you or your family members' healthcare and needs. And we can listen to your experiences of using healthcare services in Berry and use that again, as we were saying earlier, to raise awareness. And here are our contact details. So if you guys can just give me 1 second, I need to stop sharing that screen. Get the other slideshow up. Then, slideshow. Okay, Sarah, whenever you're ready, my love.
Great, thank you. Thanks, Charlotte. So thank you very much for inviting me to have a chat today on your Facebook Live for Healthwatch Berry. My name's Sarah Plant and I work at the Macmillan Cancer Information and Support Service. We're based at the Royal Oldham Hospital, but we do cover the area of Berry along with Oldham and Haywood, Middleton and Rochdale.
Sorry, Sarah, sorry to interrupt you. I've put the wrong one up. I'm
it's really all right.
Oh, this. Let me just
it's all right, don't worry.
Fix myself a second. Get through that. We've done all that. That's brilliant. Oh, it looked familiar when I opened it. I'm very sorry. Honestly, it has to be something every time, doesn't there? Come on, Charlotte. Okay, so screen share.
There we go.
This is the right one. Slideshow. Perfect. Okay.
Lovely. Thanks, Charlotte. So yeah, as I say, my name's Sarah Plant and I'm working with the Macmillan Cancer Information and Support Service. I'm the assistant manager for the service. As the slide says, we are currently based at the Royal Oldham Hospital where we're going to be having a new centre built, but we also do outreach and support patients at Fairfield General Hospital and Rochdale Infirmary. So we support patients with emotional, financial and practical support, and we give guidance to anybody affected by cancer at any point in their journey. We support people living in Berry, all the areas of Berry, Oldham, Haywood, Middleton and Rochdale. So lots of different types of support that we provide. We're a team of 4, and we also have some volunteers as well who help us. The service has been running for over 10 years. And in that time, it's grown quite a lot in terms of the support that we provide. So there's all types of different things that we do to support people living with cancer. And we're going to go through some of those things today during the presentation so that you can get a feel for what we do and how we might be able to help you or somebody that you know with a cancer diagnosis. We have really close links with our clinical nursing teams, our cancer nursing teams. So Although we're not a clinical service, we can link you into the clinical teams if you're supported by them at the hospital. So the first thing that is a major part of our work is providing emotional support. So if you've had, or somebody that you know has had, a diagnosis of cancer, you'll probably be aware of the range of emotions that can be faced and how those emotions can change over time. They can vary from one extreme to another, and also how they can impact people with the day-to-day lives. So we're used to talking to people. Our team are all skilled in communications training. We've got some members of the team who have training in psychological support. So this is a big area of where our work's based. So you can contact our service. A lot of people contact us by telephone, but we do also provide visits to wards for inpatients. And we will be having a Macmillan pod, a little pop-up pod at Fairfield General Hospital, where we'll be able to see anybody affected by cancer there. So we work by providing the time and the space for anybody affected by cancer to have the opportunity to talk about their emotions and the feelings. We know that it can be really, really difficult to put into words exactly how somebody feels, whether that's somebody who's got a diagnosis themselves or somebody that is supporting a patient. We also know that it can be really tricky to speak to loved ones because of some of the feelings that can be faced, such as anger, such as guilt. It can be difficult to talk to a loved one about how you're feeling because you don't always want to put those feelings onto them. So by talking to somebody like myself and members of my team, you're able to talk to somebody who doesn't know you, who isn't going to make any type of judgments about what you're saying, who'll be absolutely fine if you get emotional because it's normal when you're talking about cancer. And it just gives you the time and the space to have that opportunity to chat. And we can also help you navigate how to have conversations with about cancer. It's really tricky sometimes to receive a diagnosis and then have to tell people, because quite often people will ask lots and lots of questions, and you might not always have the answers to those questions, or you might not feel like you're in a place emotionally where you want to talk about it. You might want people to know, but you might not want to go into great detail. So we can help you and support you about how to have those conversations. As I mentioned, on our team, we do have members of staff who are able to give psychological support, but sometimes the psychological support that's needed can be more in depth. So we know of a range of services who can support with those needs. That might be issues to do with your cancer diagnosis. It could be issues to do with being a carer, but we can make referrals for you to support agencies around Bury and in other areas as well to make sure that you get the support that you need. Next slide, please, Charlotte. So a big part of having a cancer diagnosis, and something that we hear quite often and is often a really big immediate concern for people, is about how they're going to cope financially. So as you can see there, an average of 40% of people report a fall in household income after getting cancer. And that's because there's lots of different costs entailed with cancer diagnosis and also an impact on lifestyle. So for example, travelling to the hospital, you might have to travel to the Christie Hospital, and that might be quite a way away, Bury to South Manchester, especially if you're stuck in traffic, it can take quite a long time. So we can give you information about how to claim back travel costs if you're eligible. If you're attending Fairfield General Hospital or the Royal Oldham Hospital or Rochdale Infirmary and you're a cancer patient, we can help you by providing a free parking permit. for parking on site so that you're not having to pay those parking costs. We can also get you access to benefits advisors, because for somebody who perhaps was working before their diagnosis and has had to take time off or has had to reduce their hours, the financial impact on that can be huge. So there are benefits advisors out there who we have links to, who can support with finding what you'd be entitled to and helping you make those applications for benefits, because they can be quite unwieldy and often very overwhelming, especially with everything that you're going through at this point in time with a diagnosis. As Macmillan Cancer Support as well, we also provide Macmillan grants to people diagnosed with cancer. There is an eligibility criteria within that, but generally we're able to support people with a Macmillan grant for things that they might be faced with the cost of, such as increased heating bills because they're staying in more often, or perhaps if they've lost weight, cost of new clothing. And sometimes it can be those little things which really play on people's minds. So that's one way that we're able to help. I think, as well, as we all know at the moment, we're all hearing about the increased cost in energy bills, utility bills, and we have advisors with our Macmillan support line who can help with looking at energy costs and seeing if you're entitled to a different rate of energy cost, helping you to work out how you can save energy, all those little steps that you can take to reduce your energy usage. And then there's also a team as well that can support with financial planning. So that might be something like an insurance policy that somebody has, and there might be an element to it that if somebody is diagnosed with cancer, they might be able to claim on that policy. So that team can give information about that. And we can also support with things like obtaining a solicitor to write a will. Quite often, a lot of people don't have wills, but it's really important so that, you know, if things progress with their illness, they can know and they can feel reassured that their finances are taken care of. So that's another way that we support our patients. Next, please. Thanks, Charlotte. There's lots of practical concerns as well following a cancer diagnosis. Now, they might be concerns from the patient, or there might be concerns with carers. Sometimes some of these concerns are already an issue for people before they've had a cancer diagnosis. And so we quite often get asked about things like housing, such as maybe somebody's housing isn't suitable for their needs. Maybe they're in a second floor flat and they can no longer manage the stairs. So we can support with housing applications, and we can also support with writing letters, such as if somebody's already applied for new housing, we can do supporting letters stating why that person is in need of extra support or a new accommodation. Sometimes as well, when somebody has a cancer diagnosis, they might find that there's things around the home that they struggle with. It could be the stairs, it could be getting in and out of the bath, but they really want to retain their independence as much as possible. And so sometimes little adaptations made in the home can really help to maintain that independence. We can do referrals to community occupational therapists, for example, to have an assessment of somebody's needs at home, and from there adaptations can be made, such as grab rails, such as extra banisters, help with equipment for cooking. You know, if somebody's having issues with the nerve damage in the hands following treatment, all those types of things can be helped with. And we also support with blue badge applications, and we do that quite a lot. And we find that because of the way things are moving now, with lots of things going online, lots of application types going online, that can sometimes hinder people from being able to make an application themselves. So we can support with that. And we're also able to talk about how we word those applications. Quite often people really want to focus on the positive and what they can do. but we have a chat with people and we'll say about, you know, okay, so on your very worst day, how do you manage with your mobility? What do you struggle with? And we can put all that into an application. Next slide, please, Charlotte. Thank you. So it's really important with a cancer diagnosis to stay as active as possible, because it has a massive positive impact on health and well-being, and it can help to reduce the side effects of treatment. We also know that it can help with recovery. So after an operation, the more active you've been beforehand, and the quicker you're able to be active afterwards within your limitations, can really help with the reducing the recovery period. So we have links to exercise referral programs, and they're great because they're within your local community, and there's people on those schemes, personal trainers on those schemes, who have had specific training and specific education about supporting people with a long-term condition. So for example, if somebody's had an operation recently and they want to get back into fitness, or they want to start getting fit again, they might not have done anything beforehand, those people will be able to put together a program of exercise that's suitable and tailored to their individual needs. So it's not like going in the gym and being expected to run 5 miles on the treadmill. It's nothing like that. It builds up over time. And there's lots of advice and support out there about building up your exercise and your physical activity, and doing it within your limitations as well. You know, not running before you can walk, looking at adapting things so it's suitable to yourself, such as chair exercises and things like that. And there's also information out there about local groups, such as local walking groups. There's quite a lot of local walking groups that are available in Bury and the areas surrounding Bury. So we have links to all that information and can support you with that. Next slide, please, Charlotte. Thank you. So sometimes people start to think about, well, you know, I've got through my treatment, or I'm doing okay with my treatment and I fancy going away. And I think a lot of people do at this point after all the limitations of COVID. So lots of people are starting to think about this again. But navigating travel, going abroad, when you're either living with cancer or have had a cancer diagnosis in the past, it can be quite confusing. There's a range of things to consider, such as informing your insurer of your medical history and finding somebody that's going to be a good insurer for you in terms of price and the cover that you need. So there's lots of things out there that's available, which you can access through our service. We've got a really good travel booklet with lots and lots of information out there, such as understanding what your insurance provider would want to know about your diagnosis and the questions that they'd ask, so that you can feel informed before you make that call to somebody. You know exactly what they're going to ask and the information you need at hand. There's also information about travelling with medication in terms of who you'd need to notify, or perhaps if you need assistance in the airport, how you can go about getting that and what the assistance would cover. And then quite often we get asked about, oh, could you tell us about an insurance provider that's really cost effective, because they all seem quite steep in the cost of premiums. And what we do with that is we signpost people to our Macmillan website, because on there is a community forum, lots and lots of different topics. And one of the topics that's really, really popular is about travel and cancer. And quite often it's about people putting on there about their experiences with insurance providers, saying about, you know, I found this provider and they gave me a really good rate. It wasn't as expensive as what I've seen before. So that's a really good source of information. And we have all this information to hand within our service that we can signpost people to and that we can refer them to as well. Next slide, please, Charlotte. Thank you. So diet and nutrition, really, really big one. This can be affected in lots of different ways. It can be affected by having a cancer diagnosis, such as if somebody has, say, for example, an esophageal cancer, that can affect their ability to swallow. It can affect the amount of food that they can eat and the type of food that they can eat. So, for example, they might not be able to eat harder foods. The foods might have to be pureed. It could have to be softer, such as mashed. There's lots of information out there within our service about how your diet could be affected and ways of managing that. So, for example, the things that you can do if you've lost your appetite, sometimes treatment might change it. You might have really loved chocolate beforehand, and then after treatment, you might be like, oh my goodness, I don't want to, the thought of chocolate, it just doesn't taste right. So we can help. We've got recipe books that we can provide to help people to kind of play around with their appetite, look if they need to manage their weight. Lots of healthy eating information out there. But we also know as well that this can have an emotional impact on people, because quite often we use eating out as a social activity. And sometimes when people have this change in the diet or change in appetite, or even are left after treatment unable to eat, that has a massive impact on them in terms of socializing. They might stop going out with friends. So we can discuss that, and we can discuss ways of managing that for people. There's a lot of information out there, and it's finding what is suitable for each person, because it's not a one size fits all. And our service is very much about providing personalised information and support to everyone. Thanks, Charlotte. So we've mentioned a lot about support during the presentation, and there is support out there, but sometimes it can be really, really difficult to find the support that's needed. And again, each person's different in terms of what they require. As our service works, we have lots and lots of links within different communities, and those communities all offer different things in terms of support groups. There are support groups for different cancer types. There are support groups for people living with cancer. There are support groups for carers, but trying to find them can sometimes be quite difficult. And our service can do that for you. We can take that stress away, and we can look and see what's available in the communities, what types of things they're offering. And sometimes, there'll be things like Berry Cancer Support Centre who will signpost people to. We have a course ourselves called the Hope Course, which we're going to start running again later in the year, which is for helping people to overcome their problems effectively that cancer's caused. And that's really good, because we look into all different things such as relationships and goal setting. And it just gives people a chance to talk amongst other people who've experienced something like they have. And sometimes as well, having had a cancer diagnosis, having gone through treatment, people can kind of withdraw into themselves a little bit. And then sometimes they will want to re-access support. That might be social support within the local community. So we have different links to groups within the community. If somebody's feeling a little bit isolated, for example, in Presswich, there's the new Presswich Circle that started to run, which is a great form of support. And they have lots and lots and lots of different activities that people can get involved in, and they can have a look and see what they'd like to do from there. And that's something that's really, really important for people, just to kind of get back out there, and all the way through, whether it's they're at the diagnosis point, they're going through treatment, or they've finished treatment, support is needed, and there's lots of things out there that we can help you to access. Thanks, Charlotte. So we have a small team of volunteers who are brilliant. They've been with our service since, some of them since the service began. but we are looking to expand our volunteer team, and we're hoping to, as I mentioned, we're going to have a pod at Fairfield General Hospital and one at Rochdale, and we've got lots and lots of different opportunities for people who would like to volunteer with our service, such as things like running awareness stands or helping with health and wellbeing events, or maybe just meeting and greeting people to the service when people come to us at the new pod at Fairfield, being a presence there, for example, and just being able to listen to somebody and then signpost them to the necessary services that they need. So there's lots of opportunities with our service. And if anybody out there is interested in volunteering with us, please do give us a call. Our number's there, it's 0161 656 1026. And we'd be happy to chat with you, find out what your interests are, tell you about our role and take it from there. We offer lots and lots of training as well, communications training, cancer awareness training, and we can really work with you and what you're interested in. Thanks, Charlotte. So we know as well that when people are going through a cancer diagnosis and all the subsequent treatment, there are good stories out there about the care that they get, but also at times there are things that happen that need to be improved. And we always want to ensure that people affected by cancer are at the forefront of everything that we do. To do that, we always want to hear from people who have been through our hospitals for cancer treatment and find out what their experiences are. And what we're doing now is we're kind of doing a bit of a shout out to see if there's anybody who would like to get involved, who would like to share their stories with us and become one of our patient representatives. So we do have a group of patient representatives at the moment, and they get involved with things like focus groups. So for example, we've recently been working with a team about obtaining feedback about their service and how they can help patients. And there was a focus group that supported with that. Our patient representatives also get involved by sharing their stories at meetings so that those people who are looking at cancer services within Bury, within the different communities, can really understand the impact of what happens during a cancer diagnosis, during treatment for our patients, and where we can improve our services to make things better for our patients and anybody affected by cancer. They support our different campaigns and they get involved in one-off projects. So we're hoping to have some of our patient representatives involved with the building of our new centre at Oldham in terms of their input and insight into what is needed for patients and giving opinions on the environment and really having a really useful and worthy voice into everything that we do. Thanks, Charlotte. So there's different ways that you can get in touch with us. There's our email address there and our phone number. We do go out to the different hospitals, such as Fairfield General and Rochdale Infirmary, and we're based at the Royal Oldham. So as mentioned before, we'll go and see patients on wards. If you know of somebody who you think, oh, they're in hospital at the moment and they've been diagnosed with cancer, they might benefit from a visit from this team, you can ask them about it and then they can get in touch with us, or a ward member of staff can get in touch with us and we'll make a visit. We know that being in hospital can be quite an isolating and lonely time, especially with everything that's gone on with COVID. So we'd be happy to go up and see people on wards and have a chat and just find out what's really kind of concerning them at the moment. What can we support with? We also do health and wellbeing events, so you might see us about the community in Bury and other places. There's lots of ways to get in touch with us, and we work Monday to Friday. Our centre is open 8 till 4, so there's lots of opportunity to contact us there. Thanks, Charlotte.
Oh wow. I didn't know you did so much, Sarah. Wow. Thanks for that. That was amazing.
Thank you.
Right, okay. I'm going to pass over to Steph, who's got some questions for you.
Hi, Steph.
Steph, are you there, lovely?
So are we ready for the questions?
Yes, please.
Thanks, Sarah, for sharing that valuable information with us today. I'm sure there'll be plenty of viewers who'll take a lot from that. I just want to say before I launch into the questions that, you know, the local walking groups you mentioned, I know there is a scheme called Walking for Health, and they run from different areas in Bury, and the lady would need to speak to go on to any of them walks a bit Cranston, and they're based basically activity at Bury Castle Leisure Centre. So that is my comment. So a few questions for you, Sarah. Obviously these are like genuine, so they're not like aimed at me, but more for like the general public. So here goes. A close relative has just been diagnosed with cancer. I'm devastated about it. What support can I give that person who's just been diagnosed?
Thanks, Steph. So I think there's two issues there, isn't there, with that question? I think there's obviously the issue of giving support to the person that's been diagnosed, but also for the relative as well. They've said that they're devastated. So we need to go in there with support for both people, really. So I'll start off by talking about giving support for the person that's been diagnosed with cancer. And really, the best thing is about talking and listening. So giving the space and the opportunity to talk if the person wants to, and really respecting their boundaries with that, knowing that they might not always want to talk, or there might be issues that they don't want to talk about because they don't feel comfortable with it. And really following their lead with that, in terms of if they say, I don't feel like talking today, just letting them know that that's okay, but you're there at other times for them to talk to. And also kind of making not every conversation about cancer, because if somebody's got a cancer diagnosis, you know, that diagnosis is one part of their life, and there's so much more than that diagnosis. You know, they might be a husband or a wife, a mother or a father, an employee, a friend. It's talking about everything and making sure that we don't just solely focus on cancer all the time. It can sometimes be difficult as well not to take things personally. I mentioned before about the different feelings that somebody might have, such as anger and guilt and frustration. And if you talk to somebody about their diagnosis and how they're feeling, that will come out, and you might hear things that you think, oh, I didn't really want to hear that. So I think with those types of things, it's trying not to take it too personally, and also maybe signposting them to a service like my service, so that they've got someone to talk to who is impartial, who doesn't know them at all. And then as well, there's things to think about, like things not to say, such as, you know, if somebody says, oh, you'll be fine, or you've got to try and stay positive, well, that can be easy for us without the diagnosis to say, but for that person that's living that cancer experience, not always easy to do. So it's just kind of thinking about some of the things that are said. And it's also, if you're supporting somebody with a diagnosis, thinking about other ways of helping them, such as making specific offers of help. Sometimes people will say things like, oh, if you need any help, let me know. But then the onus is on the patient to say what help they need. And that can be quite tricky to say, really need somebody to take me to an appointment, or I really need somebody to mind my children whilst I go to an appointment. So we often say, if you want to help somebody, it's really useful to give them a list of things that you can do, such as you might say, do you know what, I'm absolutely rubbish at gardening, but I make a mean chicken casserole. So if you want that, or I could find somebody that's good at gardening for you and find a gardener. That type of thing, making those specific offers of help. And remembering at the same time that this person might feel like they've lost quite a bit of their independence. You know, their lives might be surrounded by hospital appointments, medical professionals, and they might be feeling like they're struggling to retain their sense of self and being able to do things themselves. And then for that person that's feeling devastated, you know, that's a really difficult time. And again, it's about having the ability to talk to somebody, maybe another family member, and seeing how they feel, sharing experiences, or again, someone like myself in our service, to give that support and to make people feel reassured that their feelings are totally normal. And I think as well, we've spoke about, you know, not making everything about cancer, looking at doing other activities. If somebody's a carer, doing activities for themselves, such as getting to the gym and doing some exercise to let off some steam, you know, making sure that they've got time for themselves. But really, really important that they consider their own feelings as well, and not just the patients, because otherwise, you know, they will struggle and they might not be able to give the support.
So thank you, Sarah. So what if somebody, obviously we've talked about, you know, carers and being
Steph, I think your internet's really, really bad.
So if someone is a carer of those with cancer, they're exhausted to Hello?
I think we're just losing you there, Steph, a little bit.
Oh, sorry. So, yeah, so it was the question about carers. So, like, obviously, what support is available to a carer if they're, like, working full-time and they're caring for a person with cancer and they're exhausted and they just want that little bit of extra support? What's available to them?
Okay, that's a really good question, Steph. So it's something that we come across quite a lot, because sometimes people don't see themselves as carers. If it's somebody who's looking after someone in their family and, you know, they're giving that caring support, they don't often class themselves as a carer, because they think, well, it's my mum or dad, so it's what I've got to do. But if someone's giving unpaid help, they are a carer. And it's very tricky to juggle everything, and it's about recognising that it's tricky and it's okay to ask for help. So there are different things that can be done. So if somebody's working full-time, for example, as you said in that question, then I would be asking somebody, you know, have you had a chat with your employer? Have you had a look at your employer's policies and guidelines to see if they've got anything that they've put into place for carers? Because there are rights out there for carers who are employed. There are some rulings about it. So you can ask for things like flexible working arrangements. If you've been working for your employer for more than 26 weeks before you put a request in, you can ask for flexible working to be considered, such as a reduction in your hours, or maybe working some of the time from home, or working your hours in a different way so that you can take the person that you're supporting to hospital appointments. Or it could even be something more simplistic, such as if you tell your employer what's happening, you know, is it okay if I take personal calls during my work day? And just letting them know what's going on, because if they don't know, then they often can't help. So it can be quite a tricky conversation to have sometimes, because people feel like having that conversation might make their employer think, oh, well, they can't do the job. But that's not the case. There are guidelines out there and there are legal rulings out there that mean people should be supported in those instances. And there are also things where there's other types of support that can be got as well. So if the person doing the caring is feeling like things are becoming too much for them and they're unable to cope, maybe the care that they were giving was fine at first, but the person's needs have increased over time, then maybe an assessment from adult social care could be needed to see if there's any care that can be brought in, such as carers coming into the house to give personal care visits, that type of thing. And I think it's, again, that type of thing that we've mentioned, that if you're a carer and somebody says, how can I help? Give them a list of ways that they can help. Because then they'll think, okay, well, I can do that. I can help you with taking the person to an appointment if you can't manage it because you're at work, or I can babysit your children whilst you're accompanying that person to an appointment. So there's things like that that can be done. And also coming back into services such as mine and having that time to talk to somebody and looking at other places that can help as well, such as the Berry Carers Hub. That's a great form of support where there's support such as peer-to-peer support. You can talk to somebody else who's in or has been in a similar position to yourself.
Thank you, Sarah. And a couple more points. Obviously, so general again. So I've been feeling a bit fatigued. I've noticed, a bit of weight loss. Could that be cancer, or am I like just worrying over nothing?
Thanks for that, Steph. So I think with a question like that, it's always important to think each individual person knows their body best. They know what's normal for them. They know when things don't feel right, in a way like they're not quite feeling like they usually do. As you say, that feeling of being fatigued, or there's been a bit of weight loss, anything like that, if it's ongoing and there's not a reason behind it, so somebody's not been dieting or they've not been, doing ultra hard exercise, that type of thing, if there doesn't seem to be any reason behind it, then we would always say it's important to make an appointment with the GP. And there are different signs that we would say to look out for, such as you've mentioned, fatigue or unexplained weight loss, or things like unexplained bleeding with stools or in the urine, or between periods, or maybe a change in bowel habits, or getting more breathless more easily, being out of breath going up the stairs when that's not happened before.
Yeah.
All those things are things to look out for. And if it's unexplained and if it's going on for like longer than 3 weeks, we would always say, book an appointment with your GP, explain what the symptoms are. Your GP can do the tests necessary. Might not be that there's a cancer diagnosis, it could be anything, lots of reasons out there, but it's always better to get checked for your peace of mind and reassurance, and to just get the support and any treatment that's needed.
Yeah, and thank you, Sarah, that's really informative. Just one more point to make. Obviously, about Macmillan, obviously, does that rely on funds and donations? And if so, how can members of the public make donations through fundraising and stuff?
Yeah, great question, Steph. So yeah, Macmillan Cancer Support does rely on fundraising, you're right, and things like our Macmillan grants and funding for our clinical nurse specialists is all helped by the funds that are raised by the general public. There's a vast array of ways that people can fundraise. Sometimes people might just want to make a one-off donation, and that's really simple to do. There's on the Macmillan website, there are a list of ways that that can be done, such as via the telephone, via online banking, sending a cheque to Macmillan. And then some people decide to do fundraising events as well, and they want to do, you know, something that they get sponsored for. We have a fundraising team at Macmillan who can support with all that, and they can help with finding, you know, gathering materials for you to publicise your event, and helping you to know how to run a fundraising event. And we can put you or anybody else in touch with those teams. And obviously as well, come September, we have our coffee morning, our Macmillan coffee morning, which we'll be holding on our site, where we have lots of lovely cakes for everybody. So we'll be doing that in September, at the end of September.
Hi, sorry, I'm still muted, talking away. All right, Sarah, thanks so much for that today. So I just wanted to confirm that the details are all on the live, so we can go back in the video to find your contact details. If anyone's struggling though, we're more than happy to signpost over to Sarah, so do get in touch either way. And thank you so much for your time today, Sarah. Really appreciate it. That presentation was amazing. Thank you.
No, thank you, Charlotte, and thank you, Steph. It's been really enjoyable, and thank you for giving us the opportunity to talk about our service.
It sounds amazing, honestly. Wow. All right, lovely. Thank you so much for today, and we will see you soon.
Yeah, take care, everyone. Bye.
Bye.